So welcome to class to learn how to take a manual blood pressure today. And so you have your sphygmomanometers there. That's a strange word, but you see the S word that's actually on your sheet? I want you to try to repeat after me. Say sphygmomanometer. Manometer. Now let's put it together. Sphygmomanometer. We're never going to say that in the real world. We're going to ask for the manual blood pressure cuff. And we're teaching you today as a CNA, as a newly licensed healthcare provider. It's rare that you will have to do a manual blood pressure cuff, but in case the electronic blood pressure cuffs stop working, we need you to know how to do so the old-fashioned way. And the first thing we have to teach you how to do is to read. So the gauge is what we use. It has a needle, and the mmHg. In order to perform a blood pressure, you have to know how to read the gauge. So the mmHg stands for millimeters of mercury. So once we start inflating the bulb, we're adding pressure. So it's letting us know how much pressure is in that valve, and your needle will start to inflate. This is 20, and everything is in increments of 2. So when you're taking a manual blood pressure, you cannot get an odd number. So if this line is 60, what is one line above 60? 62. Great job. Whenever you're taking someone's blood pressure for the first time, if they have a history of hypertension, meaning that their blood pressures are higher than normal, we will often just ask them what their last blood pressure was, if they can remember. If not, when you're in nursing school, they'll teach you a 2-step method. Today, I'm teaching you the easiest way. So if you tell me that your blood pressure is normally 120, when I inflate the cuff, I'm going to go about 30 above what your normal is. If you start hearing quarter cough sounds, if you start hearing those thumps right away, let all of the air out and go 30 above where you last heard it. The goal is to get an accurate reading, because based off the reading that you obtain, this person could require medications, or we may need to hold medications, because on the opposite extreme, we have people who are hypertension. But one of my friend's wife today, she passed out because her blood pressure was low. We call it hypotension. So what you do is really important, and we need it to be accurate. So are there any questions on how to read a cuff? No. The blood pressure consists of 2 numbers. We have our systolic, which is the top number. That's the pressure on the vessels as the heart pumps. The second reading is called diastolic. That's the pressure inside the vessels when the heart rests. So everyone say systolic.
Systolic.
And diastolic.
Diastolic.
Systolic is more important. Systolic is really indicative of cardiac issues. So when that top number is high, that could mean that that person is having an emergency, and you want to let your nurse be made aware. When the bottom number is high, diastolic is high, and if that's the only concern, that could be because of pain. It could be because of anxiety, or maybe the person ate too much salt that day. If both numbers are high, we have an emergency. So just to recap, which number is more important as far as when you're reporting it to a nurse? Is it the top number or the bottom number?
The
top number. If the bottom number only is high, you can ask the person questions like, do you have any pain? And if they say, yeah, that could be like an indication. What if both numbers are low? What could that mean?
Isn't that bad?
It's like they're finna pass out.
It's bad. They could be about to pass out. So do you want that person getting up and walking?
No.
No. They need to be in the bed. You make sure you give them a call bell, and you're going to call the nurse. Go get the nurse for that patient. All right. So let's show you how to use these cuffs. I'm going to ask that initially you keep the cuff wrapped onto itself. Even though you may be left-handed, I'm going to ask that you put the bulb in your right hand and the cuff in your left. So I'm going to keep it tight for you. It'll be less for you to have to. This one isn't. So this clamp, let's try to keep it on. Is yours okay in the back, Shelby?
Yes, ma'am.
Okay. So cuff in the left hand, bulb in the right hand. Cuff in the left hand, bulb in the right hand. And with the bulb, you want the valve, the metal valve, to be nearest your thumb and your pointy finger. I want you to turn that towards me. So make it tight by turning away from you. Roll it away. And now it's going to be a little bit more challenging for you to inflate the cuff because there's not an arm in the cuff. But I want you to keep inflating and you're going to watch your needle start to move. So go ahead and start pumping, pumping, pumping. Big pumps. And when you get to, let's say 160, you can stop. So you got to keep your two fingers on this and keep it closed. All right, and so we wouldn't do this on a real patient. We would not just pump it to 160 and stop because, of course, this hurts. So now what I want to do is teach you how to deflate slowly. Put two fingers on the dial and bring it back towards you slow. If you hear air escape, it means that you're deflating too fast. And it should drop about 2 millimeters of mercury per second. So if it's dropping too slow, just bring it towards you a little bit more. And you all are doing a very good job. When you get to about 60, just go ahead and let all the air out. All right, so if you hear all the air, that means that you didn't close your valves. All right, and good, and you can let the air out. Great job, team. And let the air out slowly. Control that needle. Great job. And once you get to 70, just like we did before, you can let all of the air out. If you're taking a blood pressure in the real world, you would let all the air out once you stop hearing tones, once you stop hearing the quarter cough sounds, because that means that you have your diastolic pressure. So once you have your second number, you can let all the air out. Now I'm going to show you how to place your cuff on the patient. So if you'll go ahead and open it up. And yours is more of a sleeve type. So you sanitize. Would you please ask Jasmine if you can use her arm, or want to place the blood pressure cuff on your arm? All right, and so usually do it with the palm up, so palm facing up. And then when you slide this on, you can lower the bulb. You can let that fall to the bed. And it's going to be like a sleeve. You slide it up with the arrows facing the palm of the hand.
Right, and it's supposed to be placed up here.
So you want it in the center of the arm, but with the indicators facing the palm. So you want to turn these a little bit more, and when you tighten it, if the cuff is too small, so if you put it down too low, you won't have a spot for your blood pressure cuff. So you want to go ahead, you won't have a spot for your stethoscope. So may I please? I'm going to just bring this up some. So you want it about 2 finger breaths above the antecubital area or the bend of the arm, and you want to make that cuff snug. Okay, and yours still has some air in it from when we were practicing earlier. And then Jasmine, you can lower your arm. Thank you. And this is all that we're doing for right now. I want to make sure that you know how to place the cuff. So when you place the cuff, how far above the antecubital area should it be?
2 fingers.
2 finger breaths. And if we don't make it tight enough, all it's going to do is fall back down. So may I?
Okay, tight.
Yeah, we want to get it snug. And that's going to prevent it from falling. And now you have a spot for your stethoscope, okay? And so with your older patients, be careful with dragging that cuff against their skin, because what might happen?
You might get cut.
You might tear it. Okay, perfect, perfect, perfect. And so we will, which arm would you prefer us taking your blood pressure on? We're not going to do both. We're just only going to do one.
My right.
You're right. Okay, so we're going to take this one off. And then if you'll carefully come around to the other side. So we're going to be using a training stethoscope, and a training stethoscope will allow both of you all to listen at the same time. My only rule of thumb is if you mess up, if you lose your numbers, don't disturb the other person, because you're going to have multiple opportunities to practice. But whenever you're practicing taking a blood pressure cuff from someone, limit it to 2 attempts per arm, because the more that you squeeze the arm, the less blood flow they're going to have.
And so the reason why I gave you alcohol swabs is because I want you to clean your earpieces. And while you're doing that, I will go ahead and elevate the bed. And try to keep your bodies off of the bed. I'm going to raise it up to a working height. Good. All right. And so there should be a garbage can beside Patricia. Teamwork, go team. So now if you'll put your stethoscope earpieces into your ear, and what you want to do is you want to make sure your stethoscope is actually on. So this is the diaphragm of the stethoscope. You want to tap it. Did you hear it? Was it loud? Sometimes your stethoscope can turn and it can be off. So if it's not loud, that means it's not on. Okay, so now come over a little bit closer. And for this practice, can I get you to scoot over that way a little bit while they're practicing? Uh-oh, what happened? So yeah, palm up about 2 inches and make it tight. You want to secure it. It should be snug. You're not going to hurt her.
Okay.
All right, so this is what we're going to do is when you make it tight, I apologize if I touch your chest. When you make it tight, I need you to hold it. Hold it right here. So one hand under, and now the other hand pulls, and you're going to hold it snug while you're placing the cuff. Good job. And now when you lower it, it should stay. So whenever you're taking the blood pressure, the arm should be at the level of the heart. So you can't take the blood pressure with the arm up. And if she was seated, you want her feet flat on the floor. So what we're going to do is I'm going to allow you to practice first. Your earpieces are going this way. They move. They should be going in towards your ear canal. So they swivel. So take them out and move and just bend them a different direction. So instead of having them going back, you bend them so they're going into your canal.
Or my foot.
I think yours are looks like they're okay. So are you right-handed or left-handed?
Right-handed.
Right-handed. So you're going to hold this with either your right or left hand, and this has to go on the brachial artery. And this is an indicator here letting you know where the brachial artery is. Oh, you may have to come in some. It's a little tight. And you won't hear anything until you start inflating the cuff. So when you inflate, you can ask her what her last blood pressure was.
What's your last blood pressure? What was it? Wait, what did you say?
Do you remember your last blood pressure reading? No. Okay, so just go ahead for her for the first time, inflate it up to 150. And so what's happening?
I don't think it's locked.
It's not, so you have to close it. Do you want to switch hands?
I think I might.
Okay. Very good. And so when you switch hands, you want to make sure that this wire doesn't hit. And I'm going to put your fingers a different way. It's going to be more like this. And it moves. You got it. And press in. All right. And go ahead and inflate for me. And keep going till you get to 150. And now slowly release. And you're listening for thumps. Slow. And now you still want the needle moving. It should drop about 2 millimeters per second, excuse me. All right, so you want to keep it nice and controlled. So you don't just want it to drop real fast. You want to slow it down. All right, take those stethoscope pieces out of your ear.
Sorry.
And that is no apologies, you're learning. So I know that you heard some thumps, but then I saw you stop and then you drop fast. So
No, I literally lost it. It went down way too fast.
okay, but did you hear any thumps at all?
I did.
Okay, let's try it again. It's your second time on that arm. And this time you got to control your needle a little bit better. You have any questions?
No, man.
Okay. Two fingers and slow. right, all right. So, let me give you pen and paper to write down your number. All right, so where are your arrows? Where are your arrows? So you can't take, yeah, you gotta. So those arrows should always be pointing towards
The palm of her hand.
the palm of her hand.
That's not the tight, is it?
Okay, all right, test your equipment. We're all good. You can go ahead and you can start. So if you're uncomfortable, you can lift your arm a little bit. So what you want to do is you want to make sure that you have good placement so you're not getting interference. So instead of holding the stethoscope like this, I usually hold it with 2 fingers. I press down and lift all of my other fingers. Otherwise, you're going to hear interference. You're going to hear me touching this equipment. All right, you can go ahead and rest your arm. Press down deep. Good. And you can see the gauge. If you can't see it, you can slow. Two fingers on the controller and slowly release. Did you all hear anything?
Okay, I have a question.
Okay.
Like what? Like, are we listening to when it gets quiet? Is that like
The first thump and the last thump. The
Okay.
first and the last.
that one I didn't.
So if you didn't hear anything, maybe her blood pressure's lower.
So try
Maybe this
what,
time-
120?
But then don't give up. Don't just let all the air out when you get to 70, because she could be someone whose blood pressure is 90/60. Because I'm seeing that needle jump, and what we're not supposed to do is look at the needle jumping as an indicator. But when that needle starts jumping, that usually tells you that you're hearing sounds. And so this last time, whenever you inflate it, whenever you deflate it, let it drop slowly, but only pump it to 120. And when you hear nothing else, you can let all the air out.
Can I take your arm, please?
Yes, ma'am.
Okay, look at her palm, make sure it's lining up. So palm up.
Sorry, girl, you gotta get real close.
Perfect. But you help just a little bit. Just bring this up so they can see it a little bit better. Did you hear anything? Okay, your stethoscope's going backwards, so let's make sure that yours it's going. Remember, it's supposed to go into your ear canal, so twist them the other way. Let's tap the bottom and make sure it's on and that it's loud. Just tap the stethoscope.
Is it maybe we're putting it in the wrong spot?
No, you're putting it in the right spot. You hear that? Okay. I'm going to inflate it this time. Not hearing thumps?
I am now.
Where did you hear your last thump?
I heard one at 120.
And when did you hear the last one?
I didn't.
So you have to pay attention because I kept saying that needle move. That needle's moving. That means that you're still hearing thumps.
Yes, ma'am.
All right, so this is the last time on this arm, and then Jasmine's going to go over to the other arm.
Yes, ma'am.
So press in deep, press in, good. So that means that it's not closed. So you want to, usually I like having if you have it this way, just remember which way you turn it. So usually I'll have it that way and then turn away from you. Two fingers and slow. Confidence built.
That's it.
Did you hear anything, Jasmine? So you heard the bottom number 60. What's the top number?
Like
Like
around 120.
around 120. So I need you to give me those numbers in reverse.
120 over 7. Oh, I guess I got 70.
Okay. So whenever you're getting 70 and 60, that means that the diastolic is somewhere in between the two. And because you're just learning this, but as you are more skilled, you have to be like more precise. Because being 10 off could mean that a person is either withheld or given medications that they didn't need. But I'm proud of you all. You heard something. So now let's switch arms. And now Jasmine, you'll be on this side over here.
Can I see your arm, please?
Yes, ma'am.
Great job. Now wrap it back towards you. There we go, under and back around, keeping it tight. Perfect. Test your stethoscope.
Are you supposed to hold it with our right or left?
Whichever, right now, whichever you feel more comfortable with. If it doesn't feel comfortable, you can switch on the second attempt.
I heard 120 and 80.
So it's not 120 and 80. What is it? It's like a fraction. 120 over 80. What did you hear?
110 over 70.
110 over 70. So we're going to eventually get those numbers a little bit closer, but this is your first time taking blood pressures, and you've each